Hey, thanks for joining us today. We're going to be talking about something that's going to get you plastered. That's called plastered casting for broken bones and things like that. And Dr. John Urse is going to tell you everything you never wanted to know about casting. Is that correct?
That is correct, Terry. Thanks for the intro. Today's topic, again, plastered. It's going to be a short history of plaster casting.
Welcome to the Bone and Joint Playbook with Dr. John Urse, where we explore an extensive range of orthopedic topics and insights. Our goal is to help you understand the available orthopedic options and treatments available, and hopefully give you some answers to questions you might have. We want to thank our following sponsors.
Ted's Authentic Greek Salad Dressing and Marinade. It's healthy, gluten-free, and delicious. That's Ted's Authentic Greek Dressing and Marinade. Thanks, Ted. Ted's is available online at tedsaladdressing.com.
We would also like to thank
Stifel's GWR Group combines more than 65 years of experience helping high net worth clients consolidate, coordinate, and simplify their wealth planning strategies. The group has access to a full suite of resources to serve all of your financial needs. Email gwrgroup@stifel.com or call 937-353-2863 to speak to Guy, Brad, or Jeff Richardson. Stifel, Nicholas and Company, Incorporated.
Hey, Dr. Urse, welcome back.
Thanks, Terry. How are you today?
Today's a great day. It's beautiful outside. It's about mid-70s. The birds are singing, the bees are buzzing, and Dr. Urse is talking.
That's right. And the sky is blue.
And the sky is blue. So today's topic is something I kind of find kind of cool, especially being a kid and going through some of this crap. We're going to talk about plaster casting. Why do we do it and things like that, correct?
That's right. Today's topic is called Plastered. A short history of plaster casting.
All right. So I want to start this out by asking you some really simple questions. What year did you graduate med school?
1982.
And your first year of medical as a med student, is this one of the topics you covered, how to cast an arm, how to put somebody into a cast?
Absolutely not.
Do you not have any classes at all on how to cast?
No. You learn these. Well, in medical school, they want you to learn anatomy. They want you to learn what's called physiology, how to chemical interactions in the body work, acid base, how do you get oxygen out of your blood. They don't really care if you're ever going to be an orthopedic surgeon and can put on casts.
So when do you learn this skill?
Those would be as you get to a hospital in your first 2 years of medical school, where you see in the classroom, they're educational on the medical school campus. The third and fourth years of a 4-year program are usually out in the hospital setting. You would then say, I have an interest in orthopedics or setting bones, and then you would find the area of the hospital where broken bones are addressed by a resident or someone going to the emergency room to say, hey, little Billy broke his arm. Here's a cast. We're going to talk about how we use that to set the bone straight and hold it in a good position, which is what the important part of casting does.
All right, so that answers that question. I kind of thought it was like blood pressure. Here's take a temperature. Here's how you set a cast. I thought that was like 101 first year med school stuff. That's not it.
No, casting actually is an art, and it is not a benign art. You can't put a cast on too tight. You need it to be snug enough to hold the fracture in proper alignment. It has to be done by people that know what they're doing. Obviously, you're then sending some patient home for a certain period of time. They will often come back for x-rays every so often to make sure the fracture's lined up correctly. But the casting is it's a very specialized form of medical care.
So I know we're going to cover the history because we love talking about how things were back when the pharaohs ruled the world and, the medieval kings were out there. When did this start? As far as you know, when did kind of people understanding they had to set a bone because it was broken? When do you think that started?
Well, I think you hit the topic right on the head there. The earliest record are some of the Egyptian manuscripts and papyrus rolls that showed that the ancient Egyptians used different forms of immobilization using wax or types of mud and literally sticks to hold a broken bone or a limb in a certain alignment. They realized that you had to splint or maintain some stability across a fracture. And there are, obviously, when they dig up some of these bones from some of the archaeological digs in Egypt. They found these types of bones where a fracture occurred, but there were binders of, some were mud and sticks and wax and all sorts of different ways they used to hold a bone in an aligned position. It'd be much like taking 2 sticks and taking duct tape around it to hold your leg in a certain position.
Wasn't that what they did back in the Wild West while you broke a leg riding a horse? They'd take 2 branches and they'd tie it around your leg. And
that's all you had. Yeah, you'd have to figure something out, because if the bones aren't held in a position, then they move back and forth. We talked about bones having nerve endings. That's why a broken bone hurts. So to keep the bone from moving, you need to hold it in a rigid position, and it can be slightly crooked. Obviously, the best, what are called bone setters in the day, would try to align the leg as best they could. If something's bent to the left, we'd bend it to the right. So, the idea is to help it knit together correctly so that later you have good function in an arm or leg based on which bone is broken.
So if you're setting a bone that's broken and you say bones have nerves, do the nerves grow back?
Oh, the nerves are there. So again, once you've, hopefully if let's say your wrist has got a bad break, you fell with your arm out,
right,
or you broke your leg, and now you've gone to the emergency room, and maybe a emergency room squad driver put a big, they call them air casts, or big inflatable, like a little baby raft around your leg, just to hold it in a position till you get to the emergency room. Well, then the emergency room doctor or an orthopedic representative would then give you some sedation in an IV, because when you're going to set the bone or move it, short of putting a piece of bark in someone's mouth to chew on, we'd like people to be comfortable, because it hurts to realign it. You see those pictures of those old movies where, the guy on the battlefield's just grinning and bearing it while he gets his bone set.
Yeah.
But we have more modern methods of pain control now. So they would give some la-la medicine in an IV, set the bone, take an x-ray in the emergency room, or see how the alignment looks after you set it. Not all fractures are easy to hold, even in a cast or splint. Some of them are very crumbled or unstable, they call it, where it sometimes requires it to be fixed with plates and screws and surgery. Or if it's aligned well, then we put it in a cast, and if it knits together, the body puts calcium around it like a beaver or the dam, I guess, it's putting a bunch of mud around it, right? And it'll knit together over time, and that can take, anywhere from 3 to 10 weeks based on what bone it is.
All right. So as for those people who are hiking out there somewhere in the wilderness and they break a bone, how long do they have before they have an issue if they don't get that set properly?
Oh, it's if it's crooked, you can set it up to a few weeks. I mean,
really?
The body doesn't knit it together that quickly. The problem is it's broken, so it's going to hurt. And the other thing you worry about is if 2 bone ends are kind of crooked or bent, is it pushing on the skin? What's more important is, does the fracture break the skin or not? And it's called a compound, or what's called an open fracture. Well, now you've got the elements of mud and dirt and outside things that could get into the wound. Now you deal with infection issues. So things that come where the bone breaks out from inside through the skin, or say you get shot with a gun and it hits the bone, that is still an open area to the outside. Now, it's a lot cleaner, believe it or not, getting shot, because the missile is traveling at a high speed. It's usually doesn't have time for bacteria to jump on the bullet.
What about plaster? Let's jump into the topic of plaster.
Right.
How in the heck does somebody realize that? Where did this come from? Why didn't they come up with something else?
A lot of this came from our military forefathers who were field surgeons. A lot of the
How far back are we talking?
We're talking Middle Ages, in the 1600s, 1700s. One of Napoleon's surgeons was very well known for having used some of these what are called gypsum salts. And gypsum is a type of a compound that, when it's dried, it can form a rigid, firm splint. And there's a place in what's called Montmartre, France, which is a little artsy area above Paris.
I've been there.
Where they have these catacombs, and inside them are these caves that have a large amount of gypsum that they could then harvest with, the ability to add water and make what are called strips. So instead of, in the old days, they would actually put your leg in a wooden box, fill the box full of gypsum or some type of plaster or mud, and then they would let it harden, and then they'd knock away the box. Well, you'd walk around with this big rectangular heavy thing. It held your fracture together, but it wasn't very practical. Plaster of Paris, which was named that because of the area of Paris that we found the gypsum salts, allowed for what are called strips of gypsum to be laid out. You could then moisten them in warm water. That would set off a reaction where it would start to harden quickly. So gypsum had a couple qualities that made plaster of Paris very useful for setting bones. It was rigid and firm, which was important to hold the fractures lined up. 2, it could be molded or pushed to a certain way to help align it. 3, it's set up quickly within minutes and not hours.
So you're saying within a couple of minutes, my plaster is going to be hard.
Once you dip plaster in what's called plaster of Paris, or what you see as the white plaster, comes in strips. Now it's available in rolls. That can be a couple things. It hardens quickly. It does get warm as it heats up and hardens, but it also can be molded to hold pressure at an area where the wrist is bent a certain way. You can bend it the plaster down, and it'll hold the fracture lined up more properly. And it also has the ability to be fairly lightweight. We talked about how heavy the thing was when you had a box around it and knock away the box. So plaster of Paris was a big improvement and probably the biggest step forward in thousands of years for treating fractures.
And so once you have a fracture set with plaster of Paris, how long does it have to stay on? Because I'm freaked out about the idea of having this thing on me.
Well, first of all, let's talk about who gets plaster casts these days, and it's mostly children. In the adult world, you've seen people wearing these boots on their leg for ankle fractures. We've seen people that have lighter adaptations from plaster, and we have some models of what's called fiberglass. And some of these lighter and more user-friendly colors.
This is plaster, right?
That's not plaster. That's fiberglass.
Really?
So that's
light.
a thumb. That's a lightweight thumb splint.
Yeah.
And that can be molded. It's some of these are waterproof. If this has a soft lining like this, you can't get it wet. But they make waterproof liners now with fiberglass, so you can jump in a pool with them. Some of them have holes in them. As you see, some of the what are called fenestrations or holes, that lets air in.
I bet that's
cooler,
nice. Yeah.
And it also is lightweight, and you can jump in a pool and not worry about your cast getting wet or the lining of this cast getting wet. In answer to your question, most fractures are going to heal in 3 to 10 weeks. So the idea is you take X-rays at a weekly or biweekly basis, usually to see how the fracture's lining up, if it's what's called an unstable fracture. If you have a little chip fracture, which is a teeny piece of bone, you don't need to X-ray that every week. You do it maybe in 4 to 6 weeks.
Right.
And some of these things can be taken out of a cast and put into a splint of sort to allow some early movement of, say, an ankle or a joint, which is really up to your doctor to determine based on the type of fracture and how stable it is. Some fractures need to be held very precisely for a certain time period, so they knit together, and then we can see what's called calcium or the healing of fractures, because the crack called the fracture line will start to disappear as the body knits it together.
So that, I'm going to show a picture right now. That picture that we see in movies where the guy's got his leg up in the air,
Sure. Like even Laurel and Hardy, where, he's got a full-length leg cast up from his...
Doesn't happen anymore?
Doesn't happen anymore. We used to put a lot of people in traction. Traction is a way to put a pin through a bone and put a weight on the end of the bed, and it would hold with the weights the bone in proper alignment. And in the old days, we didn't have good what are called fixation methods. We didn't have good plates and screws or rigid rods to go down the middle of a bone.
Right.
That's a whole nother topic, is fixing fractures. And we'll have one on hip fractures and some of the other kinds of fractures that need surgery. Casting is done in most cases for children because the majority of their fractures will heal without surgery, and that's good. You just need to see what type of injury it is, make sure you've put it in the proper alignment, and then that you've maintained that alignment by getting x-rays every week or every so often, so that little Billy's wrist knits together straight, or mom gets upset, right? Because all of a sudden Billy's got an elbow going like this on one side and it's straight on the other. And she's
now, what do you do? Just curious. Let's say that happens, and all of a sudden you take the cast off, and oh my gosh, it looks like it's not quite set the way it was supposed to be. Do you re-break it?
You can, yeah. And if it's already knitted together in a crooked position, then we take like a little piece of pie shape out of the bone and then close down the one side so it can be aligned. It's called an osteotomy. It's a type of surgery where you literally have to do some, that's why you take geometry classes. You have to look at the alignment of the right angle to do a little wedge of bone removal.
Right.
And then close it down, hold it with a plate. That helps it knit together. That is not very common, that it would knit together crooked. But if it does, there's always ways to help it line up better at a later time.
So before we jump into what the future looks like, because some of the pictures that we'll put up here are just absolutely crazy, and they make me happy because what I freak out about is having an itch somewhere in that middle, right? And that would just freak
me out. And that's a really good question, because what happens is once you put a cast on, then everything underneath it is out of sight. And if it's too tight, and all of a sudden the fingers start turning blue or tingle or burn, the cast can be too tight. So
that's a good question.
If little Billy isn't holding his arm elevated in the first few weeks, it can be a real problem. So we sometimes have to cut the cast on one side to open up the cast to make room, because there's nowhere for the pressure on the muscles and the arm or leg to go. So, but if it's just itches, we tell people to take an air dryer, like for your hair, and just blow air in it.
Oh, really?
What you don't want to do is stick a coat hanger.
That's
down.
what I thought you would do.
And if you do that, and then you scratch the skin under your cast, nobody can see it. Then you get an infection, and you have problems. You don't want to put baby powder down there either. So, taking care of a cast is a whole set of different instructions. And I will give you a little lead on.
A little lead.
You said we needed to talk about banter, and I always come to a point where, when especially since we deal with children a lot and casting, I always tell people there's a orthopedic surgeon who dealt with children up in Toronto named Urse, and he wrote a book on children's fractures, and he said. The opportunity to utilize idle banter should never be wasted. He said, when you have a child come to the emergency room with a broken arm, the parents have stopped what they're doing.
Right.
They've run their children over to the neighbors, and they can't even remember if they locked their front door. He said, walk in, ask the child to point to where it hurts. Don't push on some spot that makes the child scream, or every time you talk to the child, there'll be screams, and every time you talk to them, they'll never understand. He said, tell the child you're going to put a bandage on the arm. Tell them about the history of the Turks who used to put the leg in a box and fill it full of plaster, and tell a story. And then you can talk about Andres Vesalius in the catacombs of Montmartre, France, and plaster of Paris.
I'm sure that kid would love it.
And as you go through this wandering story of idle banter, the kid's mesmerized, the parents are calm, and you're accomplishing what you want to do, which is get the kid in a cast, make sure it's lined up right, and get them out of your emergency room till the next little kid falls off the monkey bars, right?
Listen, if your kid's mesmerized by Montmartre, France, and the history of casting, we got more than a problem on our hands.
Well, we also can give them a little sedation. That makes them hold still.
So the last question I have on this before we show the new stuff, which is very cool. How does a cast not end up, like there's always like a little room in there. How does it not just bind to your arm? Right.
Well, we use what's called a soft lining. You can look inside this pink model.
Yeah.
So there's a thin, kind of like a sock. It's a very thin sock.
Right.
And that goes over the arm or leg first. Then we use what's called soft roll, which is like a soft cotton wrap. A little thin layer of that gives you some padding. Then the plaster or the fiberglass is wrapped over that. And then you have some ability, you have more ability with plaster to mold it or bend it.
Yeah.
Or kind of align it better than you do with fiberglass.
Yeah, but there's always like room in there to
There
get a
needs
coat
to be
hanger.
a little bit.
How do you not, how is it possible to get one of those created without sticking so hard to your arm?
Well, that's the art of medicine, is putting it on snug but not too tight. And if it's too tight, then again, we talked about someone's fingers turning blue, or they have more pain than usual. All of a sudden, you're getting a call 2 days later from little Billy's mom going, little Billy's like screaming in pain, like his
Little
cast
Billy.
may be too tight. So most emergency rooms have a cast tech or somebody who can use what's called a cast saw. We literally have to use a saw to cut through the fiberglass, which actually scares the kid more than putting the cast on. But they make a lot of noise too, the cast saws. So they need to invent some silent ones. We'll have
Get
to
a Dremel tool
We'll have
and
to
do it
get our
yourself.
pediatric orthopedic surgeon, Dr. Melman, back on to see if there's any nuances I've missed in the last 15 years.
All right, so let's jump into what it looks like in the future. This thing I'm going to put up here on screen looks like a skeletal thing. It has lots of room and to get air in there. And how does that work? How's that built?
Well, again, as long as if these holes are much bigger and they still have a lighter construct, or a waterproof construct, as long as the framework is rigid, it holds the fracture in a proper position. And again, these are much more user friendly. You can go in the swimming pool with them, take a shower. We used to tell people to take huge baggies over their arm or leg to try to keep the soft cotton dry.
Right.
Otherwise, then you got a wet, like having wet socks
It would
with
suck.
dry shoes. It sucks is a good word. So I think the evolution of fiberglass and some of the molds that we use now are great upgrades for holding fractures properly. People are going to never stop falling. We talked about falls, accidents, injuries. Some bones have like a little, maybe a cyst or a little small benign tumor in them, and they are prone to breaking because there was a little soft spot in the bone that you'll see you'll see some basketball players go up for a shot, come down on their leg and break it from a jump shot. You're like, well, that shouldn't happen. Well, sometimes you take an x-ray and the person had a little bone cyst or a little hole in the bone that he was born with that, just got the right amount of stress through it and it broke because of that. That's called a pathologic fracture, meaning it broke because of the inherent pathology in the bone, not because of an outward injury. And sometimes, there are certainly bone tumors that are more worrisome, but that's more rare.
So the last question I have is, and I'm going to give you a chance to make up the answer. We'll see how fast you are on your feet. How many children out of 10 you think are going to have a broken bone before they reach the age of 16 or 18?
I'd say easily between 1 and 3.
Oh,
It's pretty common.
Okay.
I mean, it's pretty common.
Yeah, we had one in the backyard the other day.
Yeah, some of these are just really nothing burgers. They are simple little things. You remember, kids' bones grow from what are called growth plates, and those are weak areas at the ends of the bones that allow what's called longitudinal growth. And that's an easy area to have an injury with the right amount of force. And usually, again, they don't require surgery. They do need to be lined up correctly, and they need to be immobilized in some form. And a lot of times the plaster is a good first few weeks device because it can be molded, as we talked about.
Yeah.
Once it starts to knit together, we get lighter things. We could change the plaster to fiberglass and when we think it's appropriate.
All right. Well, if you haven't learned enough about plaster casting and you want more information, I'm sure Dr. Urse would be happy to answer your question.
Look on AI or Google. I'm sure there's a big old world of information.
Okay. Well,
we'd like to thank our sponsors. Can we do that?
God, yeah, of course.
Yeah. So Ted's Authentic Greek salad dressing. It's a salad dressing and a marinade. Gluten-free,
two things in
dairy-free.
one. Yeah.
Yeah. And then Stiefel GWR Group, their financial consultants, Guy, Brad, and Jeff Richardson. Make sure you look at their website and see if they can help you out with some of the financial navigation we all have to go through.
We do, but we want to thank you guys for joining us today on the Bone and Joint Playbook with Dr. John Urse, and we'll see you back here again for another interesting topic. Maybe we'll talk about, hangnails or...
Probably not, but we are going to talk about some of the medicines you have to adjust having surgery.
Yes.
Some of them, like blood thinners and rheumatoid arthritis drugs. We're going to talk about that. We're going to talk about a upcoming talk on adolescent Tommy John surgery, those elbow injuries pitchers get throwing baseballs. I don't know if the cricket players have that injury. It's a different delivery. I think we have some topics called low-dose radiation for arthritis. We're going to talk about how that is a newer modality to help people avoid surgery or delay surgery. We've got a few things up our sleeve. I think they'll be pretty interesting. We're going to talk about some carpal tunnel surgery, I think, some pinched nerves to the upper extremity that cause numbness and burning. So there will be things people want to stay tuned to.
We want to make sure you don't tune us out. This is exciting stuff they're going to be listening to.
And don't forget to like us on social media and tell some friends about our Bone and Joint Playbook.
Exactly right.
We're up to number 24 in medical podcasts in South Africa now. Do you know that?
With Ebola going on and all that crap?
Well, that's a little further north in Africa, I think.
Okay, I was going to say, they got more to worry about.
They're screening people, trust me, at every border now for people coming and going.
All right. Well, hey, I'm sorry, guys. Thanks for joining us. We'll see y'all again real soon. Bye.